Doctors say there is one major red flag that could determine whether you are at risk for heart disease. A certain protein called lipoprotein will increase those chances. The protein carries cholesterol through the blood. Joining us to talk about that and some other health topics is Dr. Jeff Pothof, UW Health's Chief Quality Officer. Of course, it is American Heart Month, so this is very fitting for our February topic to kick things off. You know, there is a genetic component when it comes to this, right?
Absolutely. So unlike a lot of cholesterol where there's this combination of a genetic component and then, environmental component, what we eat, how we exercise, lipoprotein A isn't affected by what you eat or how much you exercise. It's really built into your DNA. Either you have an elevated level or you don't.
Very interesting. So obviously check with your doctor, get these things tested, be on top of it. So, things can get dealt with proactively if needed, right?
Yeah, I think so. So the interesting thing with this is, historically, we haven't tested for lipoprotein A just because there was nothing you could do about it. It just kind of was, and it increased your risk for heart disease. There are some medications in the pipeline that might actually allow us to improve people's lipoprotein A level. So I think in the future, you could see lipoprotein added to your typical HDL, LDL, triglycerides, because there would be something we could do about it.
It's so interesting. I mean, there's always new, medical interventions that are coming up every single year. And speaking of that, the World Health Organization just released new estimates when it comes to cancer diagnoses. The WHO says it will reach 35 million in the year 2050. And now, just for perspective, because I know that number sounds huge, but it was 20 million in 2022. So a big jump there, a 77% increase. This does sound alarming. Can you explain this and maybe what's driving the estimate?
Yeah, so that is exactly what we're seeing. We're seeing an increase in cancer diagnoses, so people getting cancer. We think there's a few things behind that, environmental, dietary things. Certain parts of the world, tobacco smoking still really prevalent, which all increase the likelihood of people coming down with cancer. But where we see a bit of a difference is how many people are dying from cancer. So in some countries like the United States, where we have pretty advanced medical care, we are also seeing more cancer diagnoses at a young age, but we're seeing a smaller number of people dying from cancer. Unfortunately, in other parts of the world, that's not the case. They're also experiencing, more cases of cancer, but they're also seeing more people die from cancer. And I think what the World Health Organization is trying to do is call out kind of that disparity. And are there things that we can do to try to, have more of this, ideally less cancer diagnoses, but if we're going to have more diagnoses, can we at least, have less people dying of cancer per number of diagnoses?
But is the diagnoses related to the type of testing that now exists? And obviously by the year 2050, I assume there's going to be that much better of testing?
Yeah, it has to do with testing, but a lot of it is access to testing too. So in essence, if people are going to have cancer, we want to know about it as soon as possible, because once we know about it, there are things that we can do that decrease the likelihood that you die of it. In a lot of these other countries, they don't have the infrastructure or the access to the tests or the ability to get to a place to get a test. So their diagnosis is typically much later, at a point where oftentimes there's nothing you can do to intervene on it.
I think it's a good reminder, too, that because we have access here in our country, go get those tests when you hit the certain thresholds when it comes to the age and whatnot.
Yeah, for sure.
Dr. Pothof, we always appreciate it. Thank you.
Thank you.